Here are two methods to really quickly determine the heart rate on an ECG. The first method is just to count the QRS complexes in the entire ECG. Since an ECG normally has a duration of 10 seconds, you can just multiply the number of QRS complexes by 6, which gives you the frequency per 60 seconds, which in this case would be 7 times 6 is 42. This method is useful in bradycardias, where there are fewer complexes to count, or in highly irregular rhythms. The second method is faster and is a great trick to have up your sleeve. It's just to count the number of large squares between two R waves. Normally, the x-axis of an ECG is calibrated so that one large square equals 0.2 seconds. That means that if there's just one large square between each R wave, the QRS frequency per 60 seconds, or per minute, is 60 divided by 0.2 is 300 per minute. If there are two large squares, 0.4 seconds, it's 60 divided by 0.4 is 150 per minute, and so forth. One large square is 300 per minute, 2 is 150, 3 is 100, 4 is 75, 5 is 60, and 6 is 50. Let's zoom in on this ECG. No worries, the patient was successfully treated for the anteroseptal ST elevation myocardial infarction, and we'll ignore it for now. Here's an R wave, here's the next R wave, and between them, we can count 1, 2, 3, slightly more than 4 QRS complexes. Or, for the sake of practicality, the QRS frequency is 300, 150, 100, slightly slower than 75 per minute. For purposes of efficiency in clinical practice, I highly recommend just remembering this sequence by heart: 300, 150, 100, 75, 60, 50, 40. Because let's face it, we're doctors, not mathematicians.